Pharmacological management of an atrial septal defect, ASD, is generally not the primary treatment approach since ASDs often require surgical or catheter-based closure. However, medications may be used to manage symptoms or complications associated with the defect, particularly if the patient is not immediately eligible for surgery or if the defect has led to other cardiovascular issues. Here is an overview of the pharmacological management strategies for ASD. Diuretics are used to manage symptoms of heart failure or pulmonary congestion due to volume overload from left to right shunting. Common medications include furosemide and spironolactone. Diuretics reduce fluid overload by increasing urine production, which helps reduce pulmonary edema and improves symptoms of shortness of breath. Beta blockers are prescribed for patients with atrial arrhythmias or tachycardia associated with ASD. Common medications include metoprolol and atenolol. Beta blockers slow the heart rate and reduce the force of contraction, which can help manage arrhythmias and decrease the workload on the heart. Anticoagulants are recommended for patients with an increased risk of thromboembolic events, especially if atrial fibrillation is present. Common medications include warfarin and direct oral anticoagulants like apixaban or rivaroxaban. Anticoagulants reduce the risk of blood clots forming in the atria, which can lead to stroke or other embolic events. ACE inhibitors, or ARBs, are used in patients with hypertension or left ventricular dysfunction associated with ASD. Common medications include enalapril and losartan. These medications lower blood pressure and reduce the strain on the heart by inhibiting the renin-angiotensin system, which can help prevent further heart damage. Antiarrhythmic drugs are for managing atrial arrhythmias, such as atrial fibrillation, that may arise due to the ASD. Common medications include amiodarone and sotalol. These drugs help restore normal heart rhythm or control the rate of arrhythmias, reducing symptoms and the risk of complications. Digoxin is sometimes used in patients with heart failure or atrial fibrillation associated with ASD. Digoxin helps to increase the force of heart contractions and controls heart rate, especially in cases of atrial fibrillation. Vasodilators are used in patients with pulmonary hypertension secondary to ASD. Common medications include sildenafil and bosentan. These medications relax blood vessels, reducing pulmonary artery pressure and improving symptoms related to pulmonary hypertension. The choice of pharmacological treatment depends on the patient's specific symptoms, the size and impact of the ASD, the presence of any arrhythmias, heart failure, or pulmonary hypertension, and overall cardiovascular health. Regular monitoring is essential to assess the effectiveness of the medications and to manage any side effects or complications. This includes regular follow-ups with echocardiography, ECGs, and blood tests as needed. Pharmacological management does not correct the anatomical defect itself, but helps manage symptoms and complications. Definitive treatment often requires surgical or catheter-based intervention to close the ASD. Pharmacological management is usually part of a broader treatment strategy, often used in conjunction with or as a bridge to surgical or catheter-based closure of the defect.